Welcome to Alaska Med Spa and Chiropractic, located in the heart of Anchorage, Alaska at 2011 Abbott Road. At Alaska Med Spa and Chiropractic, we pride ourselves on providing comprehensive care in a warm and inviting atmosphere. Our team of dedicated professionals is committed to helping you achieve optimal health and wellness. We are excited to announce that we will soon be offering our patients with the latest advancements in medical science.
Hello, I'm Dr. Judd Wattenbarger of Alaska Med Spa and Chiropractic. I'm here today to talk to you about an exciting therapy option that we offer right here at our clinic in Anchorage. Now, you may have heard the term stem cell therapy, but what this really refers to is a growth factor or collagen-rich complex. The more technical term is human tissue allograft. Now, we're a small locally owned business and we're deeply committed to the well-being of our community.
Whether you're dealing with bone-on-bone arthritis, cartilage degradation, or ligament and tendon injuries, tissue allograft therapy could be the solution you've been searching for.
Using a growth factor-rich complex is a medical advancement that uses the body's own cells to repair damaged tissues. Here's a little more on effectiveness from Dr. Shane Shapiro at the Mayo Clinic.
I'm pleased to report the results of a clinical trial that we've recently conducted to test the effect of stem cells to treat knee pain from osteoarthritis. We conducted this trial alongside FDA monitoring to determine if the procedure was safe and viable to perform for patients who have knee arthritis. We designed this study as a very early test of safety and feasibility. Stem cells are the building blocks of many types of adult human tissues. They can go on to form things like bone, ligament, cartilage, things that make up the joints in our body.
To sum it up, this is an FDA-backed option for individuals who might want to avoid surgery. You may be wondering, what exactly are these cells, where do they come from, and how do they work?
When hearing the two words together, stem cells, most of us would think of cells residing inside the stem of plants. But in reality, stem cells are cells that divide to produce specialized other cells in order to replace the worn-out ones and maintain a homeostasis. Think of it like a branch of a tree on which leaves, fruits and small branches emerge. Stem cells work just as similar. Specialized cells are differentiated from its precursor stem cells to maintain the body's internal environment. Until now, two kinds of stem cells of human sources have been known: embryonic stem cells and adult stem cells. Embryonic stem cell has the ability to differentiate into any necessary type of body cells, while adult stem cell has limited differentiation of cells specific only to its tissue origin.
These collagen-rich cells are unique because they have the ability to develop into different types of cells. When injected into an area of injury or damage, these allografts can transform and help regenerate the affected tissues, encouraging the body to heal on a cellular level and reducing pain.
At our clinic, we use Wharton's jelly allografts, which are known for their powerful regenerative abilities. The procedure is minimally invasive and has a low risk of complications. Many patients start to see improvement in their symptoms within weeks of therapy. We receive these tissue allografts from donated umbilical cords of healthy, full-term babies through cesarean section. We want to make sure that we're not only providing a service to improve your health, but it's also ethical.
Wharton's jelly is the gelatinous structural tissue found in the umbilical cord. It surrounds the one large vein and two small arteries in the umbilical cord, providing vital cushioning and support for the vessels to function properly without damage from entanglement or stretching during fetal development. The primary components of Wharton's jelly include a matrix of collagen types 1 and 3, hyaluronic acid, growth factors, cytokines, and proteoglycans. The Wharton's jelly collagen superstructure is similar to many extracellular matrices in sites around the body. It is an immune-privileged perinatal tissue not containing any fetal or maternal cells. It does not trigger an adverse immune system reaction, so it can be transplanted without the use of immune-suppressing drugs. The structure and components make this tissue suitable for supplementation and replacement of homologous tissues that have been damaged or depleted.
The real magic in that product is the growth factor complex, the cytokines, the proteoglycans, presence or absence of hyaluronic acid, that actually encourages your own body to have your own stem cells from your own bone, from your own blood, from your own fat, migrate to that area, and then go through the process of differentiation. And ideally, if you're using a Wharton's jelly-derived product, go through chondral differentiation, the intersubstance tear of your medial meniscus and the intersubstance tear of your MCL that I see noted on your MRI, right, needs to go through a process of healing. And your body can heal those tears, but unless your body has the appropriate building blocks to do so, you will only develop scar tissue. And that scar tissue will, number one, tear again, will, number two, leave you with a knee that feels unstable, and will, number three, only be about 60% the strength that your knee was prior to you tearing that tissue. We can use a growth factor rich and collagen rich complex, and we can administer that. We can apply it to the region of the cartilage based tear in your meniscus and in your knee, and put in the essential building blocks so that when your body does heal, that it heals through a collagen-based pathway, which is the exact tissue that was torn, versus a scar tissue-based pathway, which is what your body wants to do right now.
Some clients are concerned about how much this might hurt. Some regenerative therapies are known to be uncomfortable. Well, I'm here to tell you it hurts no more than getting your blood drawn for testing for vitamin levels. On a scale of 1 to 10, most people say it's about a 3 or a 4. Now, when we inject into smaller joints, such as the hands and the feet, because they have less cushioning material, it can be somewhat uncomfortable. But overall, most clients are very happy with their results.
Our second patient story is a physical therapist. Female, 54 years old, physical therapist with debilitating bilateral knee pain. She had numerous knee dislocations to both knees over 20 times each as a child. She was recommended for arthroscopic surgery at age 22 and was told she would need knee replacement in her 40s or 50s. She did rehab, nutrition, which included glucosamine and chondroitin sulfate, chiropractic care, and hyaluronic acid injections. It all seemed to help, but she still had problems with sitting crisscross with her children, wearing high heels for more than a couple of hours, and she could not run at all for over 30 years due to pain in her knees, and had difficulty going up and down stairs and could not do a full squat. After she got injected, the day of injection, she noticed within a week that she had mild inflammation in both knees. She noticed in about 4 weeks that she was able to wear high heels for a 2-day conference with no consequences. She also noticed she could do a full squat to get a case of water on the bottom of her shopping cart when she was shopping. She also reported to us that she decided to take up running after 12 weeks because she wanted to get in shape, to her pre-baby shape after her first child was born 20 years earlier. She describes herself as 95% better, and her quote to us and her testimonial was, "It's strange not having anything bother my knees after having problems with your knees for so long." Notice how the knees were more narrowed on the inside, or what we call a medial side, which is a typical presentation for knee degeneration. This patient was recommended knee replacement surgery. She was injected in February of 2017, and by September of 2017, not only was she pain-free, but we noticed clear space all the way through both joints on both sides.
As a small, locally owned clinic, we pride ourselves on offering personalized care tailored to each person's individual needs. We're not just treating symptoms, we're working to restore the quality of your life.
If you're living with chronic pain from arthritis, injuries, or other conditions, I encourage you to consider tissue allograft therapy. It's a natural, effective way to help your body heal and get you back to the things that you love.